Good evening. My name is Roxanne Chabot from RBC Consultants. Welcome to our SkinCeuticals webinar. This evening, we're going to be talking about a practical algorithm for the integration of skincare to improve patient outcomes and satisfaction with energy-based dermatological procedures. Our expert panel this evening is an international panel, and we have Dr. Sam Hanna, who's board-certified dermatologist, medical director of dermatology on Bloor, diplomat, American Board of Dermatology in Toronto, Ontario. Dr. Ted Lane, who's board-certified dermatologist and chief medical officer at Sanova Dermatology and executive director and principal investigator at the Austin Institute for Clinical Research in Austin, Texas. We also have Dr. Jihi Kim, who is from the Department of Dermatology at Yongin Severance Hospital, Yonsei University College of Medicine in Yongin, South Korea, and Dr. Anna Mansouri, who is medical director of Dr. Anna, the Skin Clinic in Birmingham, England, in the United Kingdom. We'd like to thank our supporters, SkinCeuticals, for making this educational event possible. Before we begin, a couple of logistic tips. If you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the information will be displayed. If you're having technical issues or if you would like to ask questions to our faculty, please submit your questions using the question chat pane on the right-hand side of your screen. At the end of this webinar, a survey will pop up in your browser 1 to 2 days later. If you could fill it in for us and send it, we'd truly appreciate it. Within 1 to 2 days of the webinar, a certificate of attendance and a recording will also be sent to you. Again, if you would like to ask any question to our faculty, please submit your questions in the question chat pane on the right-hand side of your screen, and I typed in a note there so you could see exactly where you have to type in your questions. So without further ado, I will pass the floor virtually to Dr. Lane.
Wow, Roxanne, thank you so much. I'm so excited to be here to talk about this latest publication on integrated skincare with energy-based devices. My name is Dr. Ted Lane. I'm a dermatologist in Austin, Texas. I was involved in both the initial consensus get-together for this paper as well as the writing of the paper. Let's talk about SkinCeuticals, which is, thankfully sponsoring us to be here today. Thank you so much to SkinCeuticals for doing that. They are the #1 medical aesthetic skincare brand. They're developed with doctors, 100% of the way they're developed with doctors. And they are really focused on integrated skincare in terms of what skincare products will ally with energy-based device treatments, non-energy-based device treatments to both shorten downtime as well as enhance the results. So there is a strong focus in terms of the research and product development to go along with procedures, as well as to act as standalone skincare for a regimen to improve skin quality. So I'll talk about this energy-based product procedure pairing. Then I'll hand it over to my friend Jihi Kim in Korea, who will talk about CE Ferulic Asian Skin Integrated Skincare Study. Then Dr. Anna Mansouri in England. She is definitely taking the late night shift today. She will talk about the cell cycle and microneedling RFK study. Dr. Sam Hanna in Canada will then conclude with the Phyto Plus Clear and Brilliant case study, and then we'll have some time for questions in which all of the panelists will be on and be able to answer any question our audience may have. Okay, let's go into energy-based devices with the algorithm that we developed for integrated skincare. First, we have a polling question. CE Ferulic Serum, that initial SkinCeuticals bedrock product, their North Star, has been shown to decrease downtime after which of the following energy-based treatments? Is it ablative laser, non-ablative laser, such as IPL, A and B, or all of the above? Okay, so we know that, as I mentioned, SkinCeuticals does many studies where they integrate skincare with procedures, both non-energy based and energy based. If we're focused on the studies that have been done over the last, 10 plus years in energy based treatments, which one of these has shown that they can actually decrease downtime? Ablative, non-ablative, IPL, A and B, or all of the above? A bit of a tricky question. Okay, all of the above. That's true. Now, one would consider IPL to be a non-ablative treatment, honestly. So all of the above is 100% correct. And I will actually show you that data in a few minutes. Let's go ahead and set the stage, guys, okay? What is a laser? So laser itself is an acronym: light amplification by the stimulated emission of radiation. So what do we need in order to make a laser? We have to have a source of electrons, and that's either via a gas, carbon dioxide gas, for example, or a solid such as erbium or ruby. So we have the source of electrons. Then we have to excite the electrons via external energy pumped into the enclosed space. So we excite the electrons then dance around like my toddlers did back in the day when we had a dance party. And then that causes photons to be produced. And of course, photons are emitted as wavelengths. And that is the light amplification, right? Creating an output of energy, which is the emission of radiation. So we excite the electrons, which produce photons, which is that emission of radiation that we all know so well in order to achieve the results that we need for our patients. In terms of lasers and how they work in aesthetic treatments, well, a laser is essentially a single wavelength of light, right? And so we target the different chromophores with that wavelength of light because we know that certain chromophores absorb certain wavelengths of light. So if we have the idea to reduce pigmentation, or we have the idea to reduce redness, we choose our wavelength appropriately. And that is essentially called photothermolysis. And that's what we try and do with the selective wavelength that we have. So really the conditions that lasers treat, we use them to tighten skin laxity. Essentially, if we do deep heating and we're able to denature collagen and cause tightening of the fascia, we're able to improve skin laxity. As I mentioned, we can improve hyperpigmentation. Certainly hair removal, as long as we have pigmented hair. So there's a chromophore to absorb the energy. Tattoo removal as well, although as we know, certain pigments are more amenable to removal via laser than others. Improvement of acne scarring, especially with, we could use non-ablative or ablative at this point to improve acne scarring and textural imperfections. Remove the vascular lesions. That's the chromophore, of course, is the hemoglobin that we're focusing on there, and stimulate collagen production as well. So honestly, for many of our laser treatments, we are combining wavelengths and or combining energy-based devices in order to achieve sometimes 4 or 5 of these different goals for our treatments. And it's amazing that we have the devices that allow us to do that now. Let's see if I can move forward. There we go. So what is an IPL? Intense pulse light. Certain laser companies call it broadband light. So an IPL is a form of photorejuvenation where we apply filters to a broad band of light to narrow the wavelength scope in order to treat the chromophores that we are wishing to target to achieve the goals that we would like, okay? So for example, achieving the reduction in erythema or redness on the face, 550 to 5600 nanometers, much shorter for leg veins, for example, 600 to 750. And then you could see the others in terms of pigmentation as well. It is considered non-ablative in that we are leaving the epidermis intact. So it's treating kind of the lower layers of the epidermis and or the dermis without really affecting the epidermis much at all. In terms of the conditions that we can use the IPL to treat, pigmentation and vascular are really the top two that we think about. Certainly acne can be treated as well via mainly heating versus targeting of the sebaceous gland, right? We don't think that we are able to very well target the sebaceous gland with an IPL, but certainly broad heating can help with that. Skin resurfacing and tightening and hair removal as well on certain Fitzpatrick skin types with the hair removal. Let's now move into this practical algorithm. So we've kind of talked about what we're really thinking about in terms of energy-based devices or lasers. Now, what we tried to do, there was an international panel that was brought together, and truly international, as you can see, people from around the world were brought together. And the idea was, can we formulate an algorithm that people could use that would allow them to choose the correct ingredients and or products or formulations to integrate with their energy-based device treatments that would both decrease, well, and or decrease downtime or improve results. Certainly our goal, first and foremost, was to enhance patient safety, okay? And so we needed to make sure that the products that we were choosing, first and very foremost, improve the safety of the laser treatment. But then could we also decrease downtime? Could we also enhance the outcome versus the procedure alone? So what we went through a very systematic process, right? First of all, we had to define the project. The expert panel was selected based on the scope of the project. Then literature had to be reviewed in order for us to understand what had already been published, what was available in the public domain. We needed to do a literature review and determine the strength of the literature if we were able to do that, if there was enough literature out there for us to determine the strength of that. Then we needed to meet, go through the literature that was reviewed, come up with some conclusions, and then use what's already been done, but enhance upon that to develop this algorithm. We had to then adapt it and agree to it, which is not easy when you're talking about people from different countries who use different devices and have different skin types that we deal with. And then we produce the final document, which is about to be published actually well, this month and next month. Okay, so in terms of the groups of papers that we reviewed, the groups of literature that we reviewed, the first group was energy or laser treatment. These are the keywords that we used to really whittle down to the group of publications that were reviewed. So group one, the keywords were energy or laser treatment, wound healing, hyper or hypopigmentation, scarring, melasma, or prophylactic antiviral treatment. The idea here is, what can we find in relation to energy-based devices and their goals, in particular pigmentation and scarring? Okay, group two, we tried again. This time we put in energy and laser treatment, and now we're looking for skincare in particular because we knew that was going to be the scope of our project with skincare. So we wanted to see what was already published. And so we put in these keywords: sunscreen, skincare, combined with skincare or hypochlorous acid or topical hydroquinone or tranexamic acid, kojic acid, niacinamide, or combination. So we tried to find what was available using either PubMed or Google Scholar as a secondary source, looking at about the years 2010 to April 2023. So the results of group one are on your left. This was essentially just the lasers themselves focusing on pigmentation and scarring. The results of group two, which is that integrated skincare idea, which is what we were really trying to come up with, all right? So obviously, as you would expect, the results from group one were more numerous and more impactful. We had 2 systematic reviews, we had algorithms, we had guidelines, we had randomized controlled trials, we had retrospective studies and cross-sectional studies. All of these were included in group one, a very nice, robust set of data that had been published already. Unfortunately, group two, not so much. So we had 30 that we reviewed in full versus 60 in group one. Most of the papers discussed hypo or hyperpigmentation and melasma treatments combined with laser treatment. So those were excluded. So then we were left with 17 mostly small clinical studies on topical agents combined with laser treatments and 13 reviews. Certainly no systematic review, no really great algorithm or guideline. So we kind of realized early on, okay, we're gonna have to kind of go at this alone, right? Where there's not a lot of supporting literature to give us much direction. So we are going to need to rely on our own experience and expertise. The results from group one can help guide us a bit, but in terms of what the lasers do, okay, but in terms of how we can integrate skincare, we're going to really need to forge our own path. So we were we were really at the frontier here, forging into the Wild West with very little data to support us except our own moxie and a bit of literature to support us. So we decided to section the algorithm into pre-treatment, so 2 to 4 weeks before the treatment, then the actual treatment, the care after the procedure immediately, so 1 to 7 days, and then follow-up care as well. So in terms of preparing or pre-treatment, we said, look, gentle cleanser with balanced pH, right? We want to maintain that acid mantle of the skin, which can help maintain the barrier. The moisturizer should be lipid enhanced, oil-free, non-comedogenic. The last thing we want is to engender an inflammatory dermatosis in the skin right before we start a ablative or non-ablative laser treatment, so we have to be careful there. Of course, sunscreen. We want a broad spectrum tinted mineral preferable sunscreen. 30 plus we put there. Ideally, we would ask for 50 plus SPF. And then in terms of skincare, you know, because we were dealing across borders, nationally, people have different skincare concerns. We really focused on ingredients versus actual products that are available. So see antioxidants, right, to reduce the reactive oxygen species effect on the skin, which would be inflammatory. We want to use vitamin C, E, polyphenols. Again, reducing inflammation is key as we get the skin prepared for this treatment. So we want to use soothing ingredients as necessary. So certain botanical blends are available. Hyaluronic acid, as we know, is a wonderful humectant, but also helps to rebalance the skin and support a good barrier. And anti-post-inflammatory hyperpigmentation ingredients for richly pigmented skin, really to calm down and control the melanocytes and their melanosome production is very important pre-treatment. In terms of kind of the day of the treatment, of course, we talked about makeup removal, disinfectant, antivirals might be necessary starting the day before a ablative treatment as well. Immediately afterwards, handouts to go over wound care, barrier protection, SPF, antioxidants. If we're talking about, you know, really focusing on wound healing, sometimes LED or infrared light can be helpful to decrease inflammation. Growth factors and exosomes, as we're learning more about exosomes, they may really have a place for post-ablative laser for their wound healing ability. And then of course, other opportunities to improve safety and comfort, such as ice and cooling and topical corticosteroids as well for inflammation. As we move into that immediate post-procedure time period to a little bit more prolonged, and that's up to 7 days after the procedure, we maintain a gentle cleanser. We maintain a very good cream-based or ointment-based moisturizer. We maintain a good physical blocker sunscreen, at least SPF 50. We really start focusing on the antioxidant, anti-PAH ingredients. We really think about how we can reduce swelling, make sure that we are using everything we can to reduce the risk of infection, and otherwise promote an environment that allows wound healing to occur at the quickest rate possible. For ablative procedures, we really avoid the sun as much as possible. Use sunscreen if necessary, but sun avoidance, especially for those more harsh ablative procedures. Thinking about more richer moisturizers, those ointment-based moisturizers, as if the barrier is completely ablated, and then avoiding harsh ingredients. So certainly you have to adapt this algorithm to the patient that you're treating and to the device that you're using. So avoiding harsh ingredients is probably true for those patients who have gone through a full face CO2 ablative treatment. You may be able to start using a retinoid very quickly after a non-ablative treatment, however. So really adapting is key. And so understanding the technology that you're using is absolutely key as well. Follow-up care, those 1 to 4 weeks, cleanse, moisturize, protect, all that stays the same. We want to be, though, a little bit more aggressive in terms of our use of those ingredients that help to change the skin, right? That have active effects on the skin. The retinoids, which we know are natural ingredients in terms of the retinoic acid receptors that are available. Glycolics, alpha hydroxy acids, for example, which we know help to exfoliate and help to further the brightening of the skin. And then if they're able to, resume their previous skincare regimen altogether, which may include all of the above, plus growth factors and peptides and exosomes and whatever else they were on that you feel would be important for them to restart in order to really amplify the results of the energy-based treatment that the patient just underwent. For ablative procedures, delay the introduction of these harsh ingredients until the reepithelialization is complete. All of this started with Dr. Sheldon Pinnell, who was the founding scientist of SkinCeuticals. He was the one that really understood and discovered vitamin C's ability to be applied topically and have biologically active effects on the skin. And he said this very famous quote, if you protect your skin with antioxidants every day, you can provide protection that keeps changes that have been already corrected with an aesthetic doctor from coming back and protect your investment. So he was very much into the idea that if you're going to spend money on these treatments, and these lasers and these chemical peels or whatever treatment you're doing, you have to protect that investment. You have to maintain those benefits with wonderful skincare, with integrated skincare. And he knew that antioxidants were a foundational ingredient for integrated skincare in order to protect the investment. So much so that further research was performed. So we have non-ablative studies that were done. So that 1927 nanometer laser, CE ferulic, more than controlled, decreased downtime and trended towards better dyschromia resolution and overall appearance. Clear and brilliance, which is that 1927-1440 combination that we see with the dual, just at a lower fluence really. And we see enhanced permeation when pairing with the laser. So we see that clear and brilliant laser can increase penetration of CE ferulic when they're used together. Q-switched and ND-YAG, CE ferulic had a greater improvement in the melanin index and greater observed improvement in lentigines as well. The 1565 nanometer from Luminous, that non-ablative laser, CE ferulic decreased the pain and decreased redness as well. When we look at the ablative, Dr. Weibel's famous paper from 2016 with the fractional CO2, where CE ferulic showed faster wound healing and increased expression of beta fibroblast growth factor, which is a common marker for collagen growth. So we're showing increased collagen growth, we would assume, with the CE ferulic when used post fractionated ablative CO2. And then we have another paper in 2021 showing a decrease in downtime and a trend towards better dyschromia improvement. And then CO2 laser in 2023, when used for acne scarring, we see better improvement in melanin and transepidermal water loss, and therefore increase in hydration as well. So lots of data. And this is by far not all of the papers that were done showing integrated skincare. This is a smattering, a cherry picking of some of the papers that were done, but it gives you an idea that SkinCeuticals in particular really supports this data in order to show how their products can be integrated with energy-based devices in order to achieve better results. When we're looking at some of these non-ablative laser treatments, these are before and after photos of CE ferulic. Laser alone is on the left, that's a before and after, then laser plus the CE ferulic is on the right. I think we would agree that we see more improvement in the dyschromia for the patient on the right than the patient on the left, not taking away from the wonderful opportunity that laser gives us to enhance the skin quality of these patients. But when you integrate skincare, purposeful skincare like CE ferulic, you're able to amplify those results. And I think that's what we're showing on the right. Okay, what about a product that can go after the post-inflammatory hyperpigmentation or just hyperpigmentation in itself? And it does that through a combination of ingredients such as tranexamic acid and niacinamide, as well as kojic acid. And we see why that's important, because the ingredients all do different things, but all of the steps involved with hyperpigmentation are targeted by these ingredients as well. So for example, tranexamic acid and niacinamide target melanin production. The tranexamic acid helps to improve the degradation and removal of the melanosomes, as well as increase epidermal turnover. The tranexamic acid reduces inflammation and those inflammatory triggers that lead to pigmentation. The niacinamide helps with melanosome transfer to decrease that. So now we're looking at how all these different ingredients work, and by a synergistic formula, we're able to harness all these benefits to really target all the steps of pigment production. And that's shown here, right? With a laser-assisted delivery of this product using a Q-switch 1064 YAG laser, and of course the product is discoloration defense made by SkinCeuticals. 25 Asian participants, 20 to 70 years of age, Fitzpatrick skin types 2 through 4. They had 5 sessions in 2-week intervals for 8 weeks. There's a spot size and the fluence listed there. And with the discoloration defense was applied immediately after the treatment, as well as twice daily for the study period. Okay, so if you look at this, is a little bit confusing. It was a split face study. The entire face was treated with the laser, but only half the face was treated with the discoloration defense. So if you look at the left side of these photos, A, B, C, and D is all one patient. A and B, of course, is the right side of her face that was just treated with the laser. C and D is the left side of her face that was treated with the laser and discoloration defense. The same goes for the other face, E, F, G, and H, where the top is the laser alone, the bottom is the laser plus discoloration defense. And if you just look at A, B, C, and D, I mean, yes, we see improvement with laser alone, a little bit of improvement with laser alone on the right side of her face. But look at what discoloration defense does along with the laser. I mean, certainly the pigment isn't completely gone, but the darker pigment is gone. The erythema underlying the pigment is gone. I think this clarity is improved as well. And if you look at the right side, I mean, the lentigos really didn't respond very well to the Nd:YAG, right? But when we look at the Nd:YAG plus the discoloration defense, we do see nice improvement. We are enhancing the discoloration defense's concentration in the epidermis and dermis via laser-assisted delivery. So what this is showing is certainly integrated skincare is important, but take advantage of that immediate post-laser time period to start adding your actives, because you're going to get an increased concentration and you're going to really allow the actives, excuse me, the skincare ingredients to showcase their benefits. And that's what we're seeing here. By applying immediately afterwards, in addition to every day, we're seeing some really nice results that we just don't see with laser alone. Okay, so the necessity of prevent and protect. The non-negotiable in the dermatology toolkit, of course, is SPF, right? But SPF isn't the entire answer. It's partial protection against solar radiation. Don't forget to include your antioxidants as well. I tell patients antioxidants act as little internal sunscreens for your cells. Much like the melanin is like the little umbrella for your cells, topical antioxidants just enhance the sun protection that you need in addition to your SPF, which is why you're starting to see so many products now with antioxidants combined with chemical and mineral filters, because we know that antioxidants are so important for a complete broad spectrum protection in the sun. So topical antioxidants and sunscreen are a compelling basis for sun and environmental protection in 2024. Certainly, I didn't even really talk about the environmental protection of antioxidants, but we know, again, SkinCeuticals has done a ton of data to show that we can do kind of a holistic protection against the exposome when we're looking at diesel engine exhaust plus the UV light plus particulate matter. All of it is we have tons of data to show that the exposome's effect on the skin can be mitigated with the use of antioxidants. And then we've got the SPF that we should use in addition to really target the effect of UV light. So in summary, we talked about the algorithm that helps you choose products, ingredients that integrated skincare for these energy-based devices to stimulate healing, reduce downtime, and improve comfort and treatments, and improve treatment outcomes. Make sure that you are combining the skincare appropriately. Dyschromia is a significant issue for skin of color patients, and the literature suggests that topical antioxidants such as free radical quenchers and tranexamic acid can protect against photo damage as well, in addition to your SPF. And the use of hydroquinone remains controversial, especially given the alternatives currently available. We didn't even really talk about that very much, but our ability to use lasers plus lightening ingredients kind of it obviates the need for hydroquinone in my view. And we know hydroquinone is toxic to melanocytes. It's not a tyrosinase inhibitor. It's literally toxic to melanocytes, and we should try and avoid it as much as possible. Okay, that is my section, and I'm happy to hand it off now to Dr. Ji-hee Kim from Korea.
Well, thank you, Dr. Lane, for giving a very comprehensive understanding of basics and current laser treatment, as well as introducing our soon-to-be published guideline. Hello, everyone. I'm Dr. Kim from South Korea, and it's a great pleasure to join tonight's symposium. And tonight, I would like to share my experience in the use of clinical antioxidants as an adjuvant treatment option, especially for the Asian patients. And I would like to begin with the polling question. What is the most common procedural side effect that you encounter in your clinical practice? First, redness and erythema. Second, swelling and edema. Third, hyperpigmentation. Let's see how it goes. And actually, these three are the very common side effects. And actually, all three can be related together. And these are the very prevalent issues to address in the post-procedural care. And I also had the same dilemma when I treat the patients, especially those with the patients with pigmentations. So in my clinic, after the laser treatment, I apply antioxidant, especially C-ferulic or tranexamic acid, to reduce the hyperpigmentation, and I would like to share how I've done it during the past years. So the very first part of the study will be my initial experience with C-ferulic many years ago. And in our clinic, we do have many patients with pigmentations. However, the clinical results are not similar in every one of them. So I did a retrospective analysis for the patients who came in for past 3 years, and half of them had applied C-ferulic as a post-procedural skincare, and others, they used some other types of skincare products. And what we did was we assessed the digital photography taken, and also most of the patients were treated in the similar clinical parameters because I was the one who was treating, and they were treated for their melasma, lentigen, and the Q-switch Nd:YAG laser was used in a very low fluence to reduce the hyperpigmentation. And I split the group in half to a group which used the C-ferulic and other half which didn't use the C-ferulic. And I analyzed the time point after 3 sessions of treatment, and I used MASI scoring as PASI or easy to score the melasma, and also the modified MASI score. And in this study, the patients who are enrolled are mostly in their mid-50s, and all of the patients were female patients. And I will share the clinical photograph of the patients who were enrolled. So on the left side, you see the patients treated with C-ferulic after the Q-switch Nd:YAG laser. And these pictures are the post-treatment photos after 3 sessions of treatment. And on the right side, these group haven't used the C-ferulic, and they were just on the routine skincare using moisturizers and sunscreens. And as you can see, the group who's been using the C-ferulic had further reduction in pigmentation as well as slight reduction in erythema. So for these patients, I calculated the MASI scoring and modified MASI scoring to see whether there is a quantitative improvement in clinical rating. And surprisingly, the patients who use Zeferelic after their laser treatment, there were more significant reduction in MASI scoring, and also both in the modified MASI scoring. So after reviewing these patients, I've had an insight that the use of Zeferelic immediately after could actually reduce the hyperpigmentation, and also this could enhance the clinical results following the Q-switch Nd:YAG laser. So after this, we planned a prospective clinical trial whether Zeferelic could actually improve the pigmentation, and also how it could respond with the conventional skincare regimen. So here I recruited 18 patients with melasma and lentigines. And because it was a prospective study, we measured the patient's pigmentation with a spectrometer called mexameter, and the same laser parameter was used. I used low fluence Q-switch Nd:YAG laser, and one session of laser treatment was done. And here, unlike the previous study, we did a split face study, and only half of the face was applied with Zeferelic, and the other half of the same patients didn't use Zeferelic. And here we did a very short-term study, and we did 2 weeks clinical assessment with clinical scoring as well as the measurement of pigmentation using mexameter. Here, the number of patients was 18, and their mean age was in their 40s, and there were 2 male patients and 16 female patients. And now I will show you the representative data from this study. So if you see this photograph, this is a photograph from the same patient. The upper panel shows the side treated with Zeferelic, and the lower panel shows the area non-treated with the Zeferelic. The laser was done evenly for both sides of the faces, and if you compare to the upper and the lower column, after 2 weeks, there are more reduction in pigmentation as well as erythema with the use of Zeferelic. And on the right side, you can see the UV filter photography, which enhances the level of pigmentation in the skin. And after 2 weeks, there are very less improvement in the lentigines. However, the overall pigmentation has been much reduced after combining the use of Zeferelic. And what I did for these patients was I measured the pigmentation level quantitatively. So this is another example of 30-year-old female with mostly lentigines. And here, as you can see in the upper panel, the reduction of pigmentation is much further on the side where we use Zeferelic. However, since the laser was very low fluence Q-switch Nd:YAG laser, the lentigen wasn't very responsive to the treatment. And to quantitatively measure the difference, we measured the melanin index in the skin using the spectrometer, and also we measured the erythema index. And interestingly, even after the 2 weeks of application, the degree of melanin was very significantly reduced on the Zeferelic applied site. And what was also interesting was because Zeferelic has a slightly active preparation, people would expect it could be a little bit irritating to use immediately after. However, when we measured the erythema level on the patients who used Zeferelic immediately after, it didn't show any increase, and also there were some decrease in the erythema index. And we also did the clinical improvement measurement scores, and the measurement scores for melasma and also the global improvement scale were both significantly reduced in the Zeferelic use site. So from this study, we concluded that use of Zeferelic after the Q-switch Nd:YAG for the post-laser skincare for pigmentation could induce clinical improvement, and also it could prevent further pigmentation. And from the next part, I would like to introduce how I also combine the C-Ferlic with more invasive procedures. Nowadays, microneedle fractional radiofrequency has been very popular in South Korea as well as in other many countries. And the benefit of microneedle radiofrequency is since the microneedle could directly penetrate through the dermal tissue, it could serve as a reservoir for active molecule delivery. So when we apply any kind of antioxidants or active ingredients after the radiofrequency, it could penetrate deeper into the skin and it could enhance the collagen remodeling and elastogenesis, which is a desired effect of microneedle RF. And we believe that since D-ferulic has a vitamin C as an ingredient, I thought it could synergistically have an effect for ECM remodeling from the, from the microneedle fractional radiofrequency. And I'll share some clinical photographs of patients. This patient is a 49-year-old female patient, and when she came in, she had some concerns for pigmentation as well as reduced laxity. So in a clinical practice, I usually combine the laser treatment starting with Nd:YAG laser, and on the same day of laser treatment, we do combination treatment with fractional microneedle radiofrequency. And for this patient, we did 3 sessions of combination treatment of Nd:YAG laser and fractional microneedle radiofrequency, and she used C-Ferlic immediately after the procedure, and she used it as a post-procedural home care. And the photograph on the right is after 3 or 4 months after 3 sessions of treatment. And here we can see improvement in both texture and pigmentation. And this is another patient that I would like to share. She is 48-year-old female, and she came in for lentigines and wrinkles. And I did the same procedure for her, and I combined Nd:YAG laser and fractional microneedle radiofrequency as a same-day treatment. And she also used C-Ferlic immediately after, and she used it as a post-procedural home care. And after 3 sessions and almost 3 or 4 months, the clinical effect of the pigmentation has been sustained, as well as the laxity and fine wrinkles and pore has been much improved. So what we did a very small pilot study combining the fractional microneedle radiofrequency and C-Ferlic. And this was actually done right before the COVID, so there were a very small number of patients. So what we did was we recruited 6 patients and we measured the facial photography, 3D measurement for the wrinkles and laxity. And also I measured the skin elasticity by ultrasound and also the cutometer, a device to measure the skin firmness. And here we did the fractional microneedle radiofrequency, which is a non-insulated needle. And this is the parameter that I've been used. And here is a patient. The clinical study was done in a split face study, and the patient used the C-Ferlic on her half of the face, and the other side was a control side using just the moisturizers. And the study was done for 4 weeks, and we measured the 3D contour volume, and also we measured the dermal elasticity and skin laxity using the ultrasound. And the patient profile is presented on the table. The mean age was in their mid-40s, and all of the patients included were female patients. And this is a representative clinical photograph. This is a 52-year-old female who were enrolled in the study. In her case, the left side of their face were used with the acrylic after the full face fractional microneedle radiofrequency. And as you can see on the photograph on the right side, after 4 weeks and after using C-Ferlic on her half of the face for 4 weeks, there are much more densely packed collagen fiber on the dermal tissue when we measured by the ultrasound. And clinically, her her left side shows slightly improved laxity compared to the other side, which didn't use DC Fairlight. And we measured the facial curvature to represent the mid-face volume. And for the side applied with the Fairlight, the facial curvature was slightly increased compared to the other side that didn't use the Fairlight. So what we concluded from this study is using the C-Fairlight in combination with fractional microneedle could enhance the rejuvenation in terms of increased facial laxity and also increase the dermal collagen density. And what we focused was we tried to see whether this could have some quantitative measurement. And when we measured by ultrasound and both by cutometer, there were some quantitative increase in the measurement by the ultrasound. However, it was not statistically significant because we had only a small number of patients. However, we could see there were some quantitative increase in skin laxity and dermal thickness compared to the control side. And also what we try to assure is applying C-Fairlight immediately after should be very safe and non-irritating to the patients. So we measured the melanin level and erythema level for the patients who underwent the study. And surprisingly, when we measured the erythema, the redness from the clinical study, after 3 days of application, there were further reduction of erythema on the C-Fairlight applied side compared to non-applied side. And this result is very similar with the early study by Dr. Weibel with fractional CO2 laser, which shows that use of C-Fairlight could actually reduce the post-treatment erythema even after using immediately after the clinical procedures. And this is a very brief overview of what I did in the past years. So as Dr. Lane briefly mentioned that use of antioxidants could tackle the environmental skin aging, I did an in vitro study using the skin fibroblast to whether C-Fairlight could improve the atmospheric skin aging. So if we briefly go through this, what it meant is we treated the skin fibroblasts with UV and also with a particulate matter, which is a very prevalent atmospheric skin aging exposome. And on the sites treated with UV and particulate matter, there are very significant decrease in the collagen level. However, when we treat these cells with C-Fairlight, there has been some improvement in collagen transcription level, and also without these atmospheric pollutants, C-Fairlight alone could significantly increase the collagen transcription in the skin. And this is further proven by other factors such as MMPs and TIMPs, which are the known enzymes that are used in collagen remodeling. So from an in vitro study, what we have experienced is C-Fairlight could actually reduces the level of decrement from the collagen and elastic fiber, even from the atmospheric skin aging in a lab level. And what we suggest for the patient is for those patients who live in a very polluted metropolitan area, using the combination of antioxidant formulations could decrease the level of inflammation which could cause skin aging by itself, and also in combination use of lasers and energy-based treatments, it could have a very synergistic effect and it could have a very prevention and treatment in combination. And to conclude my talk, we see many patients with pigmentation concerns, and we could suggest the patients to use combination formulation of antioxidants could be very beneficial as a post-procedural skincare. And when treating patients with lasers or energy-based devices, the antioxidant could be very helpful in reducing the post-procedural downtime and also enhancing the clinical effects. And as Dr. Lane mentioned in the proposed guideline, I believe that integrated skincare combining could enhance the post-treatment clinical outcome. And also in this era of atmospheric aging and increased exposomes, it could be used both for prevention and the treatment effect. And this concludes my talk. And now I'd like to pass on to Dr. Anna Mansouri.
Thank you, Dr. Kim, for sharing your very valuable insights. And thank you all for joining us today. So my name is Anna Mansouri. I'm an aesthetic physician and trainer. I'm tuning in right now from Birmingham, UK, where it's actually past midnight. So I've recently opened Dr. Anna the Skin Clinic here, which is the first UK flagship SkinCeuticals clinic. Now in the clinic, our ethos centers all around this integrated combination protocol that enhances the patient journey and boosts our clinical results throughout the whole treatment journey and the whole treatment menu that we offer in clinic. So I'm here today to share a case study from our clinical practice targeting hyperpigmentation utilizing an integrated protocol of active skincare alongside in-clinic procedures to optimize clinical outcomes. Now for disclosure, of course, I work with SkinCeuticals as a consultant and I'll be speaking from my own experience only on an off-license or off-label basis. Now, moving on to a poll. So what are the main skin health benefits of taurine when applied topically to the skin? So the first option being increasing NAD+ levels, or acting as an osmolyte, or stimulating skin barrier renewal, or all of the above. And of course, the reason for asking this question is that we will shortly be discussing taurine as one of the main ingredients in the new SkinCeuticals cell cycle catalyst product, and taurine is a new addition to the SkinCeuticals portfolio of ingredients. So let's have a look at the results. All of the above, which is absolutely correct. So let's get started with our case study. So this 36-year-old lady presented to clinic with dyschromia alongside sun exposure, as well as some generalized signs of aging, including mild skin laxity. She's a Fitzpatrick type 3, but she had a tan at the time of presentation. So we plan to delay her treatment until her tan settled to ensure safety and efficacy. But in the meantime, we started her on a skin regime to prepare her in an integrated manner for in-clinic procedures. Now, based on her presentation, we formulated a list of indications to focus on improving the hyperpigmentation as well as some of the generalized signs of aging by formulating an integrated and stepwise progressive treatment plan of initially preparing her skin with pre-procedure at-home skincare products, followed by a course of the new cell cycle catalyst before starting her on an in-clinic radiofrequency and microneedling course with CO2 laser applied on the same day to resurface the skin and stimulate collagen. Now, this step was being integrated further with peri-procedure SkinCeuticals product before finishing off with a long-term skin regime in order to maintain her results in the long term. So looking at her pre-procedure skin regime in more detail, we started with the skin conditioning with in the morning, Simply Clean Cleanser, Equalizing Toner, as well as Fluoretin CF antioxidant and discoloration defense serum, finishing off with advanced brightening UV defense SPF 50. And then in the evening, the same cleanser and toner followed by the Phyto A Plus serum and the AG Interrupter Advanced Cream. Now, I prefer to prepare all of my patients' skin for preferably 2 skin cycles or roughly 8 weeks before investing in any further in-clinic procedures. As per the brilliant Dr. Pinel, it's a way to protect the patient's investment. And then at this stage, we then moved her on to a 2-week pre-procedure protocol of the new edition of the SkinCeuticals Cell Cycle Catalyst. So with the cell cycle catalyst, we aim to gently exfoliate the skin in order to activate new cell proliferation and amplify the results of in-clinic procedures generally. In fact, some results from recently a split-phase vehicle-controlled study using the cell cycle catalyst integrated with chemical peels, which was in fact an aggressive and mild peel, demonstrated compared to vehicle that the catalyst statistically significantly improved both skin tone, evenness, and dark spot intensity prior to the chemical peel procedure itself. But additionally, post-chemical peel, catalyst statistically improved tactile smoothness in addition. Now, the cell cycle catalyst contains a multi-acid formulation of 2% phytic, 1% mandelic, 0.2% salicylic, 2% lactic, and 2.5% glycolic acid alongside 1% of taurine in order to provide a progressive and gentle multi-layer effect to boost cell energy as well as enhance barrier function, as of course what we want is to stimulate cell renewal prior to the procedure in a way that doesn't compromise or irritate the skin barrier. So here we can see the significant improvement in overall skin appearance as well as discoloration and evenness of skin tone that we achieved after just 2 months of this pre-procedure skincare protocol alone. And then at this stage, we were ready to move her on to the in-clinic integrated procedural phase to resurface the skin, promote collaneogenesis. Now, she underwent 1 session of low-intensity radiofrequency microneedling with application of CO2 laser on the same day, and this was integrated with peri-procedure immediate application of the SkinCeuticals CE Ferulic Antioxidant Serum that's been discussed, followed by the hydrating B5 hyaluronic acid serum, LED phototherapy with red and infrared light, as well as finally finishing off with the phytocorrective essence mist, the phytocorrective mask, which was then left on for the rest of the day. Now, alternatively at this stage, we could have removed the phytocorrective mask after 15 minutes and instead apply the epidermal repair and an SPF. Now, this integrated protocol is based on the concept that minimizing post-procedure inflammation optimizes clinical outcomes, because as we know, in for instance the case of medical microneedling, which is based on controlled microtrauma, the wound healing cascade is activated in 3 stages to stimulate collagen production. Now, interestingly, the maximum response here relies on reducing inflammation in the immediate post-procedure phase in order to create and support an optimal environment to achieve maximum skin remodeling. And this is the reason that I find the integration of SkinCeuticals protocols so useful in achieving minimal downtime and minimal post-procedure inflammation, hence producing optimal clinical outcomes. And as a medical skincare brand, SkinCeuticals, they really center all of their protocols and clinical research around treatment integration. And they have such a wealth of procedural guidelines available for use for us as practitioners. Now, in the peri-procedure protocol that we used, I'd like to highlight the SkinCeuticals C ferulic. Now, as we know, this is a gold standard combination antioxidant serum containing a mix of 3 antioxidants, 15% L-ascorbic acid or vitamin C, 1% vitamin E, and 0.5% ferulic acid. And together, these antioxidants synergistically promote collagen synthesis, neutralize radiation-induced free radicals, and reduce UV-induced melanogenesis. But however, when we use this alongside ablative lasers, these anti-inflammatory effects can be delivered through channels produced in the stratum corneum, creating laser-assisted topical delivery. And it is gentle enough to be used even immediately following fractional ablative and non-ablative lasers, as shown, to reduce recovery time in the parameters of swelling and erythema, as we can see here in this fabulous split phase study. So moving back to the case study, finally at this stage, alongside the home care routine that we recommended, we recommended her to move back on to her pre-procedure skincare routine and then to maintain her results in the longer term with regular in-clinic maintenance sessions where she may consider quarterly chemical peels, yearly courses of 3 RF microneedling sessions with yearly sessions of CO2 laser. And of course, this would be recommended to be integrated again with the peri-procedure protocol and perhaps the pre-procedure cell cycle catalyst for 14 days as per her initial session. Now here you can see the overall improvements in her visible skin appearance after just 1 session of RF microneedling and CO2 laser out of the 3 recommended, where I hope you would agree that her skin tone looks more even, the hyperpigmentation in her forehead and cheek area has much improved, and her skin looks overall healthier. And now, even though, again, I hope you would agree that we've got a nice improvement already, once she has completed the 3 recommended sessions and then following the period of 3 to 4 months of collaneogenesis, I would still expect this result to improve further. Now, having said this, looking at the results under the skin scope, again, we can see the reduction in dyschromia more clearly. And then finally, using the Visia skin analysis device digitally, we can see some further quantified benefits. So, with the 1 session of integrated skincare and the in-clinic procedures, we saw an increase in the percentile scores for overall skin spots from 87 to 91, wrinkles 9 to 58%, texture 40 to 70%, pores 70 to 94%, UV spots 86 to 91%, brown spots 34 to 85%. And interestingly, with an overall reduction in skin age from 41 to 32, so essentially managing to reverse her skin age 9 years with the 1 integrated session alone. So having reviewed these clinical improvements, the extended benefits to her confidence and quality of life certainly reflected this as well, as demonstrated here in this very lovely patient testimonial, and it was a very significant outcome for the patient indeed. So in summary, we've demonstrated an integrated SkinCeuticals protocol utilizing firstly home care products with a new cell cycle catalyst. Secondly, radiofrequency microneedling and CO2 laser targeting dyschromia and signs of aging with peri-procedure use of integrated products. And thirdly, maintenance home care skincare to achieve a well-tolerated yet significant improvement in general skin condition. The endpoint of this integrated approach being optimized clinical outcomes, improved patient experience and enhancing the practitioner satisfaction as well. And this is, of course, just one example of how we can very easily incorporate the new cell cycle catalyst into our daily practice and treatment plans in a simple yet effective manner. So thank you so much all for listening, and I will now hand over to my esteemed colleague, Dr. Sam Hanna, who will share some more integrated approaches.
Thank you so much, Dr. Mansouri, and thanks very much. I'm very excited to speak with all of you tonight. I appreciate the opportunity. Thanks to the team at SkinCeuticals as well. I'm Sam Hanna. I'm a dermatologist in Toronto. I'm in my private office with some colleagues at Dermatology en Bloor. I'm also adjunct faculty at the University of Toronto. Tonight, I'm going to further the excellent presentation that we just had by Dr. Mansouri, talking about complexion enhancement and further discussing peri-procedural treatment and skincare and some new tools that we have had come online from the SkinCeuticals portfolio that I think are really exciting and going to help us achieve even better outcomes for our patients. I know all of us who see patients for aesthetic reasons discuss complexion every day. This idea that people come to seek normalization, improvement, restoration of changes that they perceive from oxidative stress, photo damage, just aging over the years is really important. This is an interesting paper from some colleagues from psychology about complexion as sort of a visual cue for health. When we assess each other as human beings, parts of our brains are looking for these clues that indicate health. And certainly that happens across the skin spectrum. Patients with more richly pigmented skin, perhaps that issue is more about hyperpigmentation, though that certainly happens again across the skin spectrum. In our less richly pigmented patients, often we're talking about erythema and photo damage, that sallowness that we can see with photo aging. And so these are a lot of challenges that patients come and ask us to help with our various tools. Tonight we're focusing on energy-based devices in conjunction with skincare, and it's a really important concept, this idea of integrated skincare. So for the next few minutes, I'm going to talk to you about targeting redness and hyperpigmentation with photorejuvenation, involving, again, the cell cycle catalyst that Dr. Mansouri just spoke to us about. And since I like to keep Dr. Lane on his toes, I know he told you that we were going to talk about a case with Clear and Brilliant. We're actually going to talk about a patient of mine that we treated with IPL in addition to cell cycle catalyst. I'll show you where she started, what we did, and what her outcomes were. So this is my patient, a 40-year-old female who has a skin phototype 1 to 2, and she struggles with rosacea, both in terms of papulopustules, but also erythema, as well as some early photo damage. She's quite active, loves to be outdoors, and so especially laterally on the lateral views, on the oblique views, you can see that preauricular hyperpigmentation on the cheeks. That's starting to be a challenge. And she's noticed a little bit of dullness in her skin. So she's certainly a young-looking 40-year-old, but has started to see these changes in radiance that are bothersome. She's somebody that I've seen for quite some time, and so she does have a baseline skincare regimen that I'll talk to you about, that we've sort of developed within her means and sort of interest in terms of the number of things she's able and willing to do, both in terms of time, but also in terms of tolerance. So let's jump to a polling question. So when you think about IPL, so it's certainly a common procedure for all of us, what's your peri-procedure, what are your peri-procedural thoughts leading up to IPL? So regular skincare routine, pre-treating with an in-clinic peel, do you stop retinols, retinoids beforehand, or does it depend based on what the patient's tolerance is and where they're starting? I think this is a bit of a stacked deck, but I'll let you answer, and then we can take a look at what the responses are. Yeah, and I think that's certainly true. I think it's hard to come by hard and fast rules that fit all patients. We often will, for example, stop retinol, though it's not common that we'll do anything like a pre-peel, especially for IPL, where I do worry about the ability to tolerate the photo-induced insult that we're using with IPL. Certainly regular skincare, I think that's across the board. So let me walk you through this patient's experience. So again, her concerns and the indications here for this treatment were the redness and the rosacea that she's starting to experience. That early bit of photo damage that we saw mostly in her oblique views, and again that augmentation in that qualitative improvement. I won't go over her demographics again, you saw them. But what was our plan? Really simple plan. We wanted to see, this is a new tool for us, Cell Cycle Catalyst, that again, Dr. Masuri just did a great job of talking to us about. Why that product? And when you think about the ingredient list, what we do when we're using energy-based devices is creating controlled injuries, hopefully just injuring the parts of the skin, the factors of the skin that are problematic for patients. But what we want is that healing response, that improvement from that controlled injury that we're choosing and employing. We want that healing response to create that improvement that our patients want to see. And cell cycle catalyst is something that I think I will borrow a phrase that Dr. Lane, I've heard him use in the past. It's like Red Bull for the skin. That machinery that's turning over and creating that healthy new skin really gets a boost from these ingredients. And I think we'll see that in just a minute. So step one, we did 14 days, not a long time, 14 days of Cell Cycle Catalyst leading up to IPL. She continued her own skincare regimen, which you can see here. We've added the Cell Cycle Catalyst there. She uses Silymarin because of that acne and rosacea prone skin, as well as retexturing activator and a sunscreen, in her case, the Elta Clear SPF 46. In the evening, prescription topical ivermectin, again, because of this rosacea prone skin. And as she's able, the retinol 0.3 from SkinCeuticals, more than a couple of times a week, and she still gets a little healing, and especially on the lower face. So it just shows you, I mean, how sensitive her skin is. Then IPL, we do a lot of IPL. I'm sure a lot of you do as well. It's really a workhorse and performs very well. So for me, when we were going into this, I wasn't sure what to expect in terms of whether we were going to see a level up in outcomes or not. But we'll take a look at what we did see. And then post-procedurally, her maintenance has continued to be Cell Cycle Catalyst, as well as her own skincare regimen. And I'll show you the most recent after photos that I have for her, but we're still continuing to keep an eye. So this is, let's take a look at her outcome. So I will remind you there at the left, this is her pre-photo. As we go through, the first photo, the second photo there in the series is just at the end of that 2 weeks with Cell Cycle Catalyst. And I'm going to pause there for a second and talk about the fact I was quite pleased when I saw these photos, pleased and surprised. I think already at that 14 days just with Cell Cycle Catalyst alone, before we've done any treatment, I think the radiance and luminance in her skin, the way light reflects on her cheeks has already been improved. So I was a bit surprised to see that, and I hope that reads with the size of the images there. The third, so the photo in the middle there is post-IPL, so 21 days of Cell Cycle Catalyst, but about a week after her IPL, and she's starting to see some of those changes that we'll see, and I will show you the oblique views as well. I think they're quite telling. The fourth photo over 14 days after IPL, unfortunate little breakout on her chin there, but otherwise continuing to see some improvements in skin quality, in that radiance that she was looking for, and some reduction in erythema as well. So let's take a look at some of her obliques, because I think you can start to see some interesting changes. So again, at the left, we see that. I want you to focus on that hyperpigmentation in front of her ear there. And even just with the Cell Cycle Catalyst over 2 weeks, I'm seeing reduction in that already. This is a really nice view to see that the way that light is bouncing off the peak of her, the apex of her malar cheek there as well. A week after IPL, that's what I kind of expect to see, some of that hyperpigmentation becoming a little granular and starting to peel away. And as we go through 14 days and 20 days after IPL, I think these are really nice results, and results that, you know, we certainly do very well with IPL, but maybe a little bit better than I might have expected for her. So quite a pleasing outcome. And then we'll take a look at the other side. I think we see similar changes. Perhaps, to be honest, maybe even better in terms of the pigmentary change on the left side. So really simple. This IPL is certainly a less intense protocol than the significant and really impressive results that Dr. Mansouri showed us with microneedling with radiofrequency and CO2 laser. But it's also really, again, it's something that I think is accessible to a lot of patients. And if we can do a simple thing like add that cell cycle catalyst booster to augment our outcomes, I think a lot of patients are going to be very interested in that. It's going to help me to make them happier, sooner, and to achieve, again, a level up in those results that we've done well with, but there's always room for improvement. So the conclusions, somebody stole the mouse from me. There we go. Thank you. So again, cell cycle catalyst is an option that helps across the skin spectrum and with a variety of different skin challenges, and bundled with and integrated with a number of different energy-based devices. It's quite tolerable. It's quite simple, and that leads to better patient compliance, better outcomes. And really, it's not a difficult thing to add peri-procedurally. It really seems to yield impressive results so far, and I'm very excited to integrate it into our protocols. I think that's going to, again, enhance patient satisfaction, which always enhances physician satisfaction. And so with that, I will hand it back to either Roxanne or Dr. Lane. If anybody wants to reach out, there's my coordinates. Thanks.
So as we mentioned at the beginning, if you have any question, please write them in the question chat pane on the right-hand side of the panel. And also we have SkinCeuticals has another webinar coming up, Skincare and Skin of Color, a comprehensive approach to procedure, intra-procedure, and post-procedure. You can see the details on the QR code, and this is going to be in collaboration with Medscape Education.
Wow. Well, thank you everyone so much. Thank you to our panel who just did an amazing job. I do have some questions here, and if Dr. Mansouri is still with us, there she is. Hi, Anna. Okay, so here's some questions from the audience. Okay, when do you stop cell cycle catalyst prior to laser, and when do you restart? So maybe Anna, you want to take that one?
Sure. So what we've tried so far in clinic and what we recommend is to start once a day, 14 to 15 days pre-procedure, and you can continue that up to the day before the procedure. And then, of course, when it comes to post-procedurally, we would then put them on a long-term maintenance regime rather than a pre-procedural prep regime.
Okay. And Sam, could you answer this one? How long after the laser treatment do you start using CE Ferulic? So for example, a fractionated CO2.
CE Ferulic?
Yes.
So we will resume, depending on the procedure and sort of the intensity of it, but we will start it once we start the healing process fairly quickly, resuming CE Ferulic, because I think it contributes to the healing process, and recovery is quicker.
Yeah. I think in Weibo's paper, for example, it was started the day of, like literally post-procedure, immediate post. Is that right, Dr. Kim?
Yes. So what I've got a hint from Dr. Weibo's initial study was she used CE Ferulic immediately after the procedure. So I followed her protocol, and what I did was right after the Nd:YAG laser or microneedle radiofrequency, I did use some ice pack for the cooling, and then As for the skincare regimen, post-procedural skincare regimen, we use ferulic as for the immediate application. So before any other moisturizers or sunscreens, of course.
Great, thank you, Dr. Kim. There's a question here, and we probably should have done a better job here of explaining cell cycle catalysts. It says, please can you outline once again what skin products are cell cycle catalysts? So just to level set, cell cycle catalyst is SkinCeuticals' latest innovative product. It is in itself a product called cell cycle catalyst. It is a blend of gentle acids, both beta and alpha hydroxy acids. The total concentration of acids is 7.7%. In addition to the acids, there is taurine, which Dr. Mansouri went through very beautifully. So taurine increases the level of NAD, and NAD is kind of the gasoline for your cell's engine, right? It is the energy that your cell requires in order to achieve its functions and achieve peak performance. So either those two, a multi-acid blend plus taurine, is what comprise the product called cell cycle catalyst. It is a serum, a very light, fine serum. In your regimen, it would be the product that you would apply first, for example, after cleansing. And what Dr. Hanna and Dr. Mansouri both touched on is that cell cycle catalyst in and of itself achieves benefit, as Dr. Hanna showed in his photos where he used cell cycle catalyst alone and then performed an IPL with cell cycle catalyst afterwards. But really, and please correct me if I'm wrong, guys, but the way I think of cell cycle catalyst is a way to amplify the benefits of a skincare regimen as well as integrated skincare with procedures. And anybody else, please chime in there.
I think that's fair. I think the idea of integrating it with procedures and wrapping around procedures is something that we're increasingly doing. I will say in looking in preparation for this and looking at the impact of it by itself, I think we're going to do both. I think we're going to make it part of skincare regimens because I think we really that idea of the gasoline for the cells, that little nitro booster for skin, is something that anybody can benefit from. But again, I think all of us do energy-based treatments to patients, and I think we're just going to see that lift them up even further. I think both are going to be ways that we use it in the office.
Exactly.
What do you think?
Also with the early data behind the cell cycle catalyst, there's been the separate improvements shown when used alone in a range of skin aging parameters. There's been an improvement shown synergistically when used with C-ferulic alone, so indicating that it actually enhances the results of an existing skincare regime. And then, of course, it's being studied for pre-procedurally to enhance the results of chemical peels. So there is almost a three-dimensional part of this one product as of using it alone with the current skincare and then for pre-procedural as well. So very versatile.
I love that. Dr. Hanna, there was a question that came in. Are chemical exfoliators contraindicated in use with IPL in terms of worsening existing redness or skin tone or pigment?
I think so. I don't tend to do that. I like the skin to be, well moisturized, well hydrated, but not. I don't tend to use a lot of chemical exfoliators ahead of time, because I think when we're using light-based treatments, that if we're thinning epidermis even a little bit, I think it increases risk of burn and injury and increased erythema. So I don't know if they're contraindicated. It's not been part of my general protocols. I'm happy to hear if I'm missing the boat on that.
Well, I think that the cell cycle catalyst is the idea of an exfoliator, right? And it's so gentle. I mean, its formulation has been proven to be extremely gentle. I just finished a trial with the use of cell cycle catalyst with chemical peels, and its formulation is meant to be extremely gentle because it's meant to be integrated skincare, either integrated into a regimen or integrated for peri-procedural use.
Yeah, it's interesting. I haven't thought of it I understand why we're calling it that. It really just seems to make healthy skin more healthy, and maybe kind of shedding the dead weight a little bit. But it's different than doing something like apricot scrub. This is not the same thing at all.
Yeah. Dr. Mansouri, would you agree?
Yeah, I fully agree. Traditionally in the past, I've been quite reluctant to use acids, Whereas now I find that this is going to be quite revolutionary because, as you say, it is so gentle. The pH is a little bit more suitable, but also interestingly, it's also been shown to speed up cell cycling and cell renewal. So whereas before I would prepare the skin with retinoids, I'm interested to see now whether this can perhaps replace or enhance that effect further with it being so gentle as well.
And Dr. Kim, one of the questions here is, can you use CE ferulic right after microneedling as well? And what do you think? And I'd also like to get your thoughts on cell cycle catalyst.
Well, first of all, after microneedling, yes, I think we can, but there could be different regulations in every different country. So if we adhere that country's regulations, we could, because microneedling itself, when we do it in clinic, it is done with more than 2 millimeters needle. So the procedure itself is quite painful even after the topical anesthesia. So when I used it immediately after, not not many patients had irritation or they complained about the formulation itself because their skin itself is rather red and swollen because of the procedure. So I used it immediately after and it was okay. And a few years ago, I did a ex vivo skin study and we applied the C-Relic on the microneedle treated skin to see whether it could impair the skin barrier function. But surprisingly, we didn't publish the study because it was a pilot study, but we we saw some increase in skin barrier functions rather than reduction of the skin barrier functions. So I could say that it doesn't impair the skin barrier function after the microneedle procedure by applying C-Relic. So yes, it is safe, but we have to adhere for the regulations.
Wonderful. One other question came in regarding the use of exosomes post-procedurally, and again, this can vary across borders in terms of regulations. To your point, Dr. Kim, I would imagine of all of us, Dr. Kim, you would likely have the most experience with exosomes post-procedural and for wound healing. I don't want to speak for others on this call as our other experts, but just knowing that Korea tends to be at the very forefront of exosome use, could you give us some of your expertise and experience in terms of using exosomes post-procedurally?
So in our regulations, we could topically apply the exosome-related products, which has growth factors or some amino acids, and it is allowed and it has some clinical effect in enhancing the wound healing and also reducing downtime. So after fractional laser for scar treatment or fractional laser for rejuvenation, exosomes are commonly used, especially the growth factors. But what could be problematic is some people use it as an injection, which is not allowed as an injected formulation. So if we don't do that, the topical applications are generally safe because those ingredients are the same ingredients approved as a medical device used as a hyaluronic acid or other medical devices. So what we commonly use besides antioxidants are growth factors and amino acid products. And those mixed formulation also helps the wound healing, but I'm not very sure about how it could enhance the pigmentation with growth factors or amino acids.
Okay. Yeah, Dr. Hannah, Dr. Mansouri, anything to add to that?
So in the UK, similarly, we can't use it for injectable, but we use it quite widely topically post-procedure across the range of in-clinic procedures. But we are still really in the early days in the UK of trialing this. But I've seen some really nice results in clinic. There is a cost implication. It is quite costly here. So from a patient point of view, it does elevate the cost. And as we're still in the early days, I'm yet looking forward to see the results further.
Yeah. Sam, agree?
Yeah, I think we're even earlier days in Canada, and I think the marketing is a little bit ahead of the science right now for me. So.
Yeah, I agree. I think if we're looking for post-procedure products, I mean, I'd rather hang my hat on those that have a ton of research behind them and rely on those. And certainly C. ferulic is one that has so much benefit and research to support its use that I find it difficult right now to rely on exosomes, although I do think they are promising. Much more data needs to be produced in order for me to change my behavior. But that's just me. Guys, I can't believe it, but we're just about out of time. Roxanne, if you want to pop back in, there's Roxanne. What a great panel.
Fabulous panel. Thank you so much to our esteemed faculty for fantastic presentations, insights, clinical pearls. And we'd like to thank you all for joining us this evening. Goodbye, everybody.
Bye. Thank you.
Bye.
Thanks.